Hello everyone, this is Lanice with Lessons from an RN. Today we're going to talk a little bit about prostate cancer, and the reason being is this year Jeff went through a journey with prostate cancer, and we just want to share with you some tips to help you determine if you have prostate cancer and what you need to do next. So today we're out having our afternoon walk at Smith Creek and Wildlife Refuge in nature. It's really nice out here today, and we thought we'd take a few moments to share some tips with you.
All right, hey everyone. Tip number one would be you need to be sure that you're checking in with your primary care physician at least once or twice a year. Someone you trust, that you believe is really insightful about your health concerns. And then step number two would be sure that you do the blood work, the PSA test, to check your PSA levels. That's one of the best indicators on whether you're at risk or not for prostate cancer. And so that's what my primary care physician did for me. He saw where my numbers started elevating over the past several years. So he had me go see a urologist, and then the urologist made sure I did an MRI, and then I went from the MRI to the biopsy, and then I also did a PET scan. So those were steps between steps 1 and 2 with my primary care physician that I saw once or twice a year, and saw my numbers elevating, and then doing the proper test work with the blood work to see where your numbers are. And then step number 3 is know your family history. I had a close relative, male relative, that had prostate cancer diagnosed a little over 2 years ago and had their prostate removed as well, and they're doing pretty good. And so I took that step as well in having my prostate removed so I would not be at risk for cancer. And so my numbers are way down where they should be. After seeing my surgeon a couple of weeks ago, it's been about 2 months now, and so I'm feeling good. We're out here taking a walk. I've always been somebody that kind of worked out and was concerned about my health, but now I'm even more concerned, and so I'm feeling real good, and pretty much that's it. So I hope that these 3 steps are helpful to the men out there.
Yes, and so I would just say that my lesson from an RN today is to make sure your loved ones are going to see a primary care doctor. If they're a male, whether they have a family history or not, get a baseline PSA level checked, and then know what those numbers are, know your family history, and go from there. And if you have any more questions about prostate cancer, I'm going to link some information below that's very simple, easy to understand, so that you know what to do and how to catch it early. So that way it doesn't spread, to other organs, and then you are out and ready to go 2 months out like Jeff is, and get back on with life. So thank you for spending time with us today. Like and subscribe to my channel for more lessons from an RN. Thank you.